Hi, PsyQ community. I'm Dr. Miranda Fisher, and I'm here with Miss Laura Kaponer again for our 8th podcast, a part of this series. Laura is a certified peer support specialist, a blogger, and a mental health advocate. So thank you so much, Laura, for being here again today.
Thank you for having me. It's truly an honor.
So for today's podcast series, we are going to talk about self-advocacy, specifically when it comes to your mental health and during both treatment and recovery journeys. Okay. And so we'll start off with our first question. So Laura, what does self-advocacy mean to you in terms of your mental health?
Self-advocacy is a little tricky. It meant different things to me at different times during my journey. First, it was getting involved in a support group and realizing that I'm not the only one and being able to speak up about my challenges amongst peers and knowing that it's okay that I'm experiencing what I'm experiencing. Another way to self-advocate is to reach out to my supports, specifically my friends and family, to let them know what helps and what hurts in my recovery. Sometimes I need space. Sometimes I need them to be a little bit more proactive, reach out to me if I'm being asymptomatic, get me out of the house, maybe some kind of distractions. Also, self-advocacy in terms of professionals is it's important to remember that they work for me. I'm paying them. So if they're giving me some kind of treatment or diagnosis, or maybe they're heading in a certain direction with my recovery that doesn't quite feel right, or it's not a teamwork atmosphere, that maybe it's not the best fit for me. I can try to express what isn't working for me, but if they're not willing to work with me and to take the direction that makes me feel like my most authentic self in my journey, then maybe self-advocacy is ending certain professional relationships and moving on to somebody that can better serve me.
Yeah, absolutely. So you were just talking about relationships with mental health professionals. So have you experienced any challenges in your treatment or recovery where you needed to be an advocate for yourself?
Absolutely. My main diagnosis is borderline personality disorder. And from my experience, a lot of people in the mental health field don't understand that diagnosis as much. So I got misdiagnosed with other things that I knew didn't quite fit me. And I kind of had to fight them on it and have them say, this is what you are, and box me in, and have me say, no, this doesn't fit what I'm experiencing. This doesn't fit the challenges. It doesn't feel quite right. So sometimes I know more, actually always, I know more about what I'm going through than somebody on the outside does, because I'm living in my own experience firsthand. So, and then there are professionals outside of the mental health field that can be very judgmental when you explain that you're on certain medications or when you explain that you have mental health issues. I'm a person just like anything else. And if I'm going for a physical health issue, I need to be seen as somebody with like an ear infection instead of a mentally ill person with an ear infection. So just kind of reminding them, I'm still a patient, just like any other patient, and please treat me with the dignity and respect that I deserve.
Absolutely. So you had mentioned speaking up for yourself is one way that you advocate for yourself and your mental health. Are there any other ways that you or either our audience can work to be advocates for themselves and their mental health? And how did this overall help facilitate your recovery?
I kind of break down advocacy into two categories. You have the people that do a lot of the grunt work behind the scenes, and then you have people that are kind of out and about in the community. And I think that they're equally important. Not everybody is comfortable with sharing their story publicly, but people like me that want to get out there and want to educate the community and kind of put a face to the 1 in 5 that experience mental health issues, I think it's important. It kind of makes it more real. But then you have the people on the back end that are doing things like fundraising activities or putting together educational opportunities, putting together conferences, writing books, getting educational material out there, doing research. And these are all different ways that we are advocating for ourselves or advocating for the community as a whole. For me, it started in the background, volunteering for NAMI, but like kind of quietly because I was afraid of the stigma. And then it got to the point where for me, I like to write articles, amazing opportunities like this podcast to let people know I'm just like you. It's okay what we're going through. There's nothing to be ashamed of. And our voices need to be heard.
Yeah. Would you say that outlets like this really help with your recovery and staying on track?
100%. It continues to remind me that I have something to offer the world, and recovery skills are just as valid as any other kind of skill set that somebody could possess. So it just reminds me of the worth that I have and what I can offer people.
Well, thank you so much, Laura, for sitting down with us today and sharing your perspective on being an advocate for yourself. And I think this really highlights the importance of being an advocate for yourself and your mental well-being. So thank you so much for being here again today.
Thank you. Excellent opportunity. And I hope that people will find some help in what we're trying to share.
Yeah, I think so. And thank you to our PsyQ audience for tuning in again today. Please feel free to look around our website and our patient and caregiver section here. We're continually updating content, and we will have many more podcasts with Laura. So thank you so much.